We've been working on telehealth for a long time. And I think many of us felt like telehealth was going to be sort of a very formal, complicated thing that involved interfacing and a bunch of other complicated technology that we'd have to drop into places and train and learn. And it turned out, by sheer necessity, literally practically overnight, we explored ways to very intuitively deliver a voice and audio interactive experience with patients to them in their homes. We quickly settled on a technology, and we made it very lightweight, very intuitive. Essentially, if you know how to use a web browser and the camera on your phone, you were up and running on this thing. We're 12 weeks in now, so we're upwards of around 40,000 virtual visits, which is just astounding. Somewhere between 40 to 50% of our care is now virtual.
Wow.
And I tell you, if you'd have told me that 3 months ago, I wouldn't have believed it. The healthcare system can be difficult to navigate, even for us, let alone folks that aren't, savvy navigators of a complex outpatient hospital system. So lowering the bar to be able to get a one-on-one encounter with a provider has been huge.
Yeah.
So that, you're absolutely right. Folks have jobs, they have families, they have kids, they have parents, they've got things going on. So we make it very easy now for them to connect with a provider. It's basically we're going to do this at 2:30. We'll ping you, hop on, and you're off and running. That's been a real game changer.
It's been such a rewarding experience as a provider. Given that we're in such kind of, a difficult time right now, you talk to these patients and the things they've gone through right now, job loss, family members in the hospital, just being able to have that, social interaction and, a face-to-face and in the comfort of like knowing that, my provider's still there for me, still able to, prescribe me my medications, check in on my vitals, make sure that my conditions, aren't worsening during this time, keep me out of the hospital. The response has been just wonderful. And as a provider, it just makes our job that much more satisfying.